Hello everyone. Today let's have a look at one of the most important chronic conditions affecting millions of people worldwide, that is diabetes. My name is Dr. Fatima Zuhra and welcome to my YouTube channel. What is diabetes? It is a metabolic disorder in which body is facing difficulty in regulating the blood sugar levels, either due to insufficient insulin production or because of the inability of the body to use insulin effectively. This can lead to elevated blood sugar levels, which if uncontrolled can cause serious health conditions. At the heart of the diabetes lies the hormone insulin, which is produced from the pancreas. When we consume food, it is converted into fats, carbohydrates, and proteins. These carbohydrates are then converted into glucose and absorbed by the cells in order to produce the energy. This insulin hormone acts like a key which opens the cells. That is, insulin carries the glucose and it helps to unlock the cells and enter the glucose inside the cells. Without enough insulin, or if the insulin is not working properly, the glucose remain in the bloodstream itself, causing blood sugar levels to rise, which we call diabetes. There are mainly two types of diabetes, type 1 diabetes and type 2 diabetes. Type 1 diabetes is an autoimmune condition. Our immune system is supposed to attack the foreign particles entering in our body or the harmful cells. But in autoimmunity, the immune system is mistakenly attacking the healthy cells of our body itself. In type 1 diabetes, immune system is attacking the insulin producing cells of the pancreas, that is the beta cells of the pancreas. When these cells are destroyed, there is no insulin production, which causes blood sugar levels to increase. This type is usually genetic and develop in childhood or adolescence. Then the type 2 diabetes. It is the most common form of diabetes. More than 90% of the cases of diabetes are type 2 diabetes. Here, the body either doesn't produce enough insulin or become resistant to its effects. It typically develops in adults, but nowadays it is increasingly seen in young individuals as well because of the certain lifestyle factors. Unlike type 1 diabetes, it is directly linked to obesity, sedentary habits or faulty food habits and is likely preventable also. Another type is gestational diabetes with high blood glucose level in pregnancy. Type 1 is mainly because of genetic factors which is not in our hand, but type 2 diabetes is mainly because of the environmental factors or the lifestyle changes which we can control. The risk factors for type 2 diabetes can be obesity or overweight, physical inactivity, unhealthy diet, poor sleep quality, stress, smoking, other diseases like hypertension, high cholesterol levels, PCOD, history of heart diseases. So as all you can see, all these diseases are related to our lifestyle. When the blood sugar levels are above the normal limit but not yet reached the levels of diabetes, that stage we call it pre-diabetic stage. That is, you have higher chances of developing diabetes in future. In this stage, body starts exhibiting certain signs and symptoms that can be few months or few years before developing diabetes. If you recognize these indicators and take action in the right time, in up to 80% of cases, you can prevent diabetes and long-term complications. Let's see what are the symptoms of pre-diabetes. Uncontrolled weight gain and obesity can be a symptom, especially the abdominal obesity. Suppose you have gained up to 8 to 10 kilograms of weight within 4 to 6 months. That can be a symptom. And in some people, BMI falls in the normal range, but their waist circumference increase because of fat deposition around the abdomen. Hyperpigmentation, called acanthosis, can be an early sign of insulin resistance. This usually happens in skin folds, armpit, behind the neck, behind the elbow or knee. Excessive thirst may indicate that your body is flushing out excess glucose. Tiredness and blurred vision are also symptoms of increasing blood sugar levels. You can confirm pre-diabetes with simple cost-effective blood test. One is fasting blood sugar. If this is between 100 to 125 mg per dl, then it is pre-diabetes. Next is PPBS, that is blood sugar levels 2 hours after eating. If this is between 140 to 200, then it is pre-diabetes. But there can be variations based on the food you eat. You may eat simple food or you may eat high sugary food also. So to standardize the values, you can go for oral glucose tolerance test. That is, you have to take 75 grams of glucose and after that your blood sugar levels will be tested. This will give more accurate values. The next one is HbA1c. That is the average blood sugar levels of the last 3 months. If this is between 5.7 and 6.4 percentage, then it is pre-diabetic. So any values within these ranges are pre-diabetic and above these ranges diabetes. There are few other tests also like fasting insulin, which is within 10 to 25 milli international unit per ml in pre-diabetes. Triglyceride to HDL ratio. In 99% of cases, if it is above 3 or 4, there are higher chances of developing type 2 diabetes. So at this stage, if you apply modifications in your lifestyle like exercise or diet management, you can prevent progression into type 2 diabetes. For example, if you lost 10% of your body weight, that will avoid diabetes in 90% of the cases. And suppose you are not able to control the blood sugar levels at this stage and you progressed into diabetes, then you can exhibit increased frequency of urination, which is called polyuria, increased thirst, which is called polydipsia, and increased appetite, which is called polyphagia. Weakness, even if you don't do much work, blurring of vision, unintentional weight loss, body's healing mechanism slow down, wounds take a long time to heal. Certain skin changes, especially skin over the legs and foot, become very dry and thick, which is called distal sclerosis. May be accompanied with itching. You may also feel numbness and pin sensation on your legs and soles. Now the diagnosis. Any blood sugar levels above the pre-diabetic level is classified as diabetes. That is, if your FBS is above 125, if your postprandial glucose levels or oral glucose tolerance test shows glucose above 200, random blood glucose level is above 200 or HbA1c is above 6.5%, then you are diabetic. Now let's look at the complications of diabetes. Type 1 diabetes usually present with symptoms, but in type 2 diabetes the symptoms may be mild or even absent, so that in 30 to 80% of cases remain undiagnosed, or by the time you diagnose it, the complications have already begun. This is why an early diagnosis and management is very crucial. Otherwise, it will cause many complications. High blood glucose levels cause progressive damage to the blood vessels all over the body. Important complications include permanent vision loss and blindness due to damage to the vessels of eyes, which is called diabetic retinopathy. Kidney disease and renal failure, which is called diabetic nephropathy as a result of damage to the renal blood vessels. Damage to the nerves, especially in the extremities because of reduced blood flow, which cause numbness or tingling sensation or loss of sensation. This is called diabetic neuropathy. Non-healing ulcers leading to amputations are also very common. High blood sugar levels contribute to plaque buildups in the arteries, which increases the risk of heart attacks and stroke. In people living with diabetes, the chances of heart attack and stroke increases up to 4-fold compared to non-diabetic people. Diabetes can also cause acute complications like sudden drop in blood sugar levels in patients who are already under insulin treatment, life-threatening emergencies like ketoacidosis, coma, or even death also. People with diabetes should seek regular screening for complications to aid in early detection. This includes regular screening for kidney diseases, regular eye examination, and food assessment. This way, you can save yourself from long-term complications and the disabilities resulting from these complications. Understanding diabetes is the first step to managing it effectively. Making healthy choices about your food, your exercise, your lifestyle, you can manage and lead a healthy and fulfilling life. I have already put a video about the management and prevention of diabetes. You can watch it in my YouTube channel. I will put the link also. If you or someone you know is living with diabetes, then share this video with them and let's spread the awareness together. Thank you for watching and don't forget to like, share and subscribe for more health related contents.